Buoy Health Insights, Swollen Fingers. Welcome to another episode of Buoy Health Insights, where we explore common health issues and their causes, symptoms, and when you should seek medical attention. Today, we're discussing a symptom that may seem minor, but can be indicative of various underlying health issues: swollen fingers. Most of us have experienced finger swelling at some point, whether from an injury or other reasons. But what exactly causes this swelling, and when should it be a cause for concern? Swollen fingers typically result from a buildup of fluid or inflammation within the tissues. What makes our fingers swell can range from something as simple as a minor injury to chronic conditions like arthritis. Let's delve into the most common causes of swollen fingers. Rheumatoid arthritis. This is an autoimmune disorder that leads to inflammation of the joints. This typically affects the knuckle and middle joint of the finger and is often accompanied by other symptoms such as morning stiffness. Psoriatic arthritis. Another form of arthritis that occurs with psoriasis and affects the joints. This commonly affects the joint nearest to the fingertip, but could affect others. Dupuytren's disease, a condition where the tissue under the skin of the palm thickens and can restrict movement. This causes the fingers to curl in and makes it difficult to straighten them. Dislocated finger usually results from an injury where the bones of the finger move out of place. This is fairly obvious and should be addressed immediately to avoid long-term problems. Cellulitis, a bacterial infection of the skin that can cause swelling, redness, and pain. Nonserious finger injury, such as jamming or spraining a finger. This will cause swelling around the area of injury, but there shouldn't be any difficulty moving the finger or gross deformity. Boxer's fracture, a fracture of the hand near the little finger, commonly from punching a hard object. Besides swelling, you might also encounter symptoms like pain, stiffness, limited range of motion, and in some cases, redness or warmth around the swollen area. Now, how do you know when it's time to seek medical care? If you're dealing with persistent swelling that isn't related to a recent injury, becomes increasingly painful, or is accompanied by symptoms like fever or a deformed appearance of the finger, these could be signs of a more serious condition needing prompt medical attention. On the other hand, if the swelling is due to an injury and it's not too severe, you might start with at-home treatments like resting, applying ice, elevating your finger, and possibly protecting it by taping it to an adjacent finger or splinting it. However, if you notice any of the following symptoms, it's time to seek emergency care. Deformity or inability to straighten the finger. Increased heat, redness, and swelling, especially with a fever. Significant increase in swelling and pain. Numbness or color changes in the finger. These could indicate a serious injury to the finger or an infection that's spreading quickly. If any of these symptoms occur, don't hesitate to see a doctor immediately. It's important to remember that while swollen fingers can be a sign of numerous different issues, the majority are treatable, and with prompt and proper care, you can alleviate the symptoms and address the underlying cause. Before we wrap up, remember to like and subscribe for more insightful health information. Your health matters, and staying informed is a great step toward better well-being. Thank you for tuning in to Buoy Health Insights. Here's to your health.